morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning. An opportunity to meet with you every Thursday morning at this time to provide you with free information about your health. We bring in the best and brightest from Mon General Hospital each and every Thursday. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, and also Greg's here.
Greg is, I don't know how to describe Greg. He's like the PR guy for Mon General Hospital, but
He's the hard-workingest guy over there.
Yeah.
That's right, Kay.
That's right.
He must spend hours and hours just compiling the information to send us in emails to let us know what's coming up on Health Talk here on WHAR.
Anything we can do to spoon feed you, Jim.
Yeah, so such is the case this week. I was spoon-fed the information for our guest this morning, joining us via telephone, Dr. Christy Clark, a hospitalist. Dr. Clark, welcome to the program.
Hello, thank you for having me.
All right, well, we know that the IST means that usually you study the subject that's before the IST. So a hospitalist or a biologist or anybody with an ist at the end studies that particular subject. So do you
Yes.
study hospitals?
Yes, pretty much.
Or what is a hospitalist? Maybe that could be the first question.
That would have been the easier way to start
Thank
off,
you, Jim.
I'm sure.
Okay.
Yes.
Well, what we do as hospitalists are, the majority of us were internal medicine trained. Some are also family medicine trained. But we specialize in the patient's care in the hospital. So as opposed to what you would get if you were going to a clinic. So we are here at the hospital. We provide around-the-clock coverage. We see patients at all times of the day and the evening. We are strictly here for the patients while they are admitted to the hospital.
Since I have no life, I was reading a little bit about hospitalists last night, and it's relatively new in hospitals. I mean,
Yeah.
late 90s. So talk about how it came into existence.
Yeah. The trend recently has been to have your inpatient care done by somebody who is strictly doing hospital-related medicine. It's mostly because if you look at the number of patients that most primary care clinics are seeing during a day, those numbers are increasing. So to have a provider who is seeing a full clinic, but then also taking care of patients in the hospital, the numbers are just becoming so high that it's really in the best interest of the patient to have somebody who is just strictly at the hospital doing their care. It provides, like I said, we are here as a 24-hour service to the patient, where their primary care physician, because of the demands of a clinic, may not be able to provide that. So the trend has really come about that you have two different services now.
And really beyond that, beyond the hospitalized patient, you go into other areas, teaching, research. Do you do that as well, or is that left to other hospitals?
Most physicians also do have side projects and do research. So that is true. Because we are at the hospital 24 hours a day, we also have very good working relationships with the specialties who are going to be seeing the patients while they're admitted to the hospital, such as cardiology, such as pulmonary. So we're able to help coordinate that care also.
So another title for you could be patient liaison, I think.
Absolutely.
I mean, you're
Absolutely.
you're an advocate for the patient.
Yes. So we are there. We are your primary doctor while you are admitted to the hospital. We work very closely with the specialty groups such as, like I said, cardiology, pulmonary, gastroenterology. So and also with other services, such as we deal a lot with hospice organizations, home health organizations, to extend the patient's care. Once you leave the hospital, we're able to extend that care and make sure that the patients are getting what they need at home.
Dr. Clark,
So it's very much an all-around type of care.
Greg Keeley's in on the show this morning, too, with you.
Good morning, Kay.
And I wanted to ask Greg about what does this mean for Mon General Hospital to have a hospitalist on board?
Well, really, Kay, it's a great partnership that we have with referring physicians. I mean, actually, a physician outside of Mon General may have decided that a hospitalist care is needed for the condition of the patient, and he or she has decided to focus on office-based care. So really, just to improve the situation of the patient as they, sometimes you have a situation where it comes up where a patient needs immediate assistance, maybe a physician is not on site and a hospitalist can take care of that immediately.
All right. To me, it sounds like another, I don't want to call it a layer of bureaucracy, but you have nurses that come into your room all the time. You have a nurse's station outside of your room. You have the doctors that make their rounds to each patient. Why was the position of a hospitalist needed, Greg?
Well, Dr. Clark could speak to this as well, but physicians can order the meds quickly and responsively and just make a quicker difference for the patient to get better in improving their healthcare situation.
And how would you answer that question, Dr. Clark?
Well, one thing that we have really tried to focus on at Mon General with our hospitalist program is having a very interactive, diverse group while the patient is being seen on morning rounds. So the days of just having a physician come in the morning, see you very briefly, and leave, those days are pretty much over. So now when a patient is admitted to the hospital and we do the morning rounds, not only are you being seen by your nurse who is taking care of you that day on the floor, your physician who is organizing your care, but also we have physician's assistants who are helping in that care, as well as nurses with our group. But also you're going to be seen by a case manager, you're going to be seen by a social worker, you're going to be seen by a nutritionist. So we're really trying to focus on all aspects that the patient would need while they're at the hospital, and it helps to coordinate that care and have faster decision making, overall having a shorter stay in the hospital, which will then lead to quicker recovery times for the patient. So to have the hospitalist who is there multiple times during the day, that can be contacted very quickly if a patient's care were to change, by the nurse would then contact us and be seen by somebody in our group. But then also the case managers, the social workers are there to help with any care that would be needed beyond that hospital stay if somebody needs that service. So our rounds have very much changed into really integrating all of these different aspects that the hospital has to offer.
I haven't been luckily a patient very often or very much, but it does seem that when the doctor's making his morning rounds that he's really busy, that he spends maybe a minute or two with you and then moves on to the next patient. So I think it's a good explanation that you gave in that making the morning rounds and being part of that, more attention to the patient is given.
Absolutely.
I mean, am I wrong in my assessment here? It seems like the doctor's real busy, Kay?
Well, of course, and it's hard for a family to always hit in at the same time that the doctor's making their rounds, and we miss them so often. We have so many questions to ask, so that's where you would come in.
We are with Dr. Christy Clark this morning. We're talking about hospitalists. It's our Mon General Health Talk program. And if you have any questions, pick up the phone and call us at 304-296-0041. We'll be back right after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Our guest today is Dr. Christy Clark. She's a hospitalist, and I think that if I find myself at Mon General, the nurses, I know, never give me water when I want water, enough water anyway, so I'm going to contact you. Is there a buzzer for you that I could
Absolutely.
just buzz you in and ask and plead with you to please let me have some water, even though the doctor says no?
We're preparing a special room for you, Jim.
Yes,
Is it
may
padded?
I decorate it?
Probably.
Padded.
Padded room, yes.
Hospitalist physician whose primary professional focus is the general medical care of hospitalized patients. And that's what we're talking about this morning. One thing that I asked Greg, Dr. Clark, is this something that all hospitals are going to, or specialty hospitals?
Yes, the majority of hospitals across the country are going to this method.
Do
Yes,
you
very
have
much
assigned patients within the hospital, or do you just have a general area, or just those that are in crisis?
We have, with our group, we have two physicians, myself and Dr. Barty. We split the floors currently, so Dr. Barty will do ICU, also the CCU, the coronary care unit, as well as the fourth floor at Mon General, which is a step-down unit and also observation. And I will do the fifth and the sixth floor, which is mostly surgical patients on the fifth floor. The sixth floor is general medicine. So as a group, yes, we take care of all types of patients from the intensive care unit to just general medical needs.
So you could say that a hospitalist is kind of like an emergency room doctor in a way. Can you expand on that?
We take it a step further than the emergency room physicians. When somebody does come to the emergency room, if they have their initial evaluation done by the emergency room physicians, if they feel that our services are indicated that a patient does need to be admitted to the hospital, we will come down to the emergency room. We will do a full evaluation of the patient there in the emergency room, and then we will proceed to take over their care for the duration of their hospital stay.
You're listening to Health Talk, brought to you by Mon General, and we do invite your phone calls. Pauline is taking advantage of that. Good morning, Pauline.
Good morning. Yes, I do have a question. I've never had I don't want to call it privilege because it wouldn't be a privilege to be in the hospital, but never had the opportunity to use a hospitalist. But the question I have is, I've been going to a primary doctor, say, for 20 years.
Mm-hmm.
How can I feel comfortable with a hospitalist that I do not know, or how can the hospitalist know my background, my healthcare background, like my physician would? How am I going to be made comfortable?
Right. And this is certainly a concern that our patients do have when they come to the hospital is how will this physician who has never seen me before, how are they going to be able to adequately, take care of my needs? And that is why we have a very good working relationship with the primary care physicians who are in the area. They know us. We do get in contact with many of the primary care physicians during a patient's hospital stay if we need to get further information. So what patients will notice when they are admitted by us is there's a lot of questions about your past medical history, about who your family physician is. That's one of the first questions that you're going to be asked is who is your primary doctor? That way we can coordinate your care with that physician. We do very, very detailed documentation during your hospital stay that is sent to your primary care physician on discharge, because in order for this type of system to work, there has to be, very, very precise care between your primary care physician and us here at the hospital. So there will, we will ask you numerous questions about your medical care, and then we will also be able to get in touch with your family doctor if that is needed.
Thank you, Pauline. Good question.
So if I'm admitted into the emergency room, do they contact the hospitalist right away to plan my care?
If it's felt that you would benefit from inpatient care, yes.
And you're in close contact with my physician?
Absolutely.
All
yes.
right.
We
And
do very detailed documentation while you're here, and everything that we will do while you're in the hospital will be sent to your primary care physician.
And the hospitalist is available 24/7. You're not on the golf course or anything, or in the middle of the night.
We have someone from our team, from our staff, who is in-house 24 hours a day, and we can be contacted, yes.
Yeah, because it seems that any emergency room visits I've ever had are in the middle of the night. So I just want to be assured that a hospitalist is going to be there at 3 o'clock in the morning.
you will be seen by somebody, absolutely. Yeah.
We're going to take our final break of the program today. You're listening to Health Talk with Dr. Christy Clark, and also Greg Keeley is in studio here this morning. If you have any questions, call now, 304-296-0041.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
So I've spent a little bit of time in the hospital. I've come to know my hospitalist, Dr. Christy Clark. Does that mean that after I'm discharged, we part our ways, or are you still involved in our health care after discharge?
Once you're discharged, the majority of your care will be resumed by your primary care physician. Something that is unique to our group here at Mon General is that if you would, by any chance, find yourself back in the hospital, you would still be taken care of by the same physician that you had before. So if you were if I had taken care of you previously when you're in the hospital, you will see me again. But the majority of your medical care once you have left the hospital will be done by your primary care physician. And that's one reason why it's so important that we have a very good working relationship with your primary care physician.
As a patient, what should I expect from my hospitalist?
What you'll be able to expect is knowing that we are here for you at all times during your hospital stay. That if you have any questions, any concerns, like was mentioned earlier, if there was a family member who was not able to be present on rounds and had questions later in the day, that we are available to come back and speak to that family member and speak to you and keep you fully updated on your plan of care and how you are doing during your hospital stay.
So no matter how minute the detail, I can contact you. I mean, good grief, you're a doctor. It doesn't seem to me that I should be able to call you with all that education that you have for just minute details. But, I mean, that's what it's all about, I guess, is taking care of the patient's needs.
Who does call you, Dr. Clark? Does the patient ask for you? Does the doctor assign you? Does the hospital? How does that work?
If you have been seen by our group previously, you will be seen again. Also, depending if a patient has a primary care physician that does still come to the hospital and admits patients, of course that physician will continue your care. However, if you do not have a physician who comes to Mon General Hospital, you will be seen by our group.
I'm sure some patients feel, well, I don't know this individual. I want my doctor to take care of me. But maybe you can explain how everything is in one file. It's not like it's on the computer. You can go see what one person has done and follow up from that. So you're very well informed of that patient before you take over any care.
Absolutely, yes. Before you are even seen by your physician, we have gone over thoroughly your past medical history, any tests that have been done prior to actually being seen by your physician. So we have a very full knowledge of why you are in the hospital, what is going on, and also because we are a 24-hour service, because we are always here in the hospital, we will discuss your care with specialties if needed. So that we have a full knowledge of everything that has been going on while you're in the hospital.
How many hospitalists are on staff at Mon General?
Right now, in our group, we have 2.
2? You're going to expand?
The goal absolutely is to continue to expand, yes.
Well, thank you so much for the information this morning, Dr. Clark.
Thank you. Thank you for having me. It's been great.
Dr. Christy Clark again on Mon General's Health Talk program here on WAJR. Video of this program, including Kay and me and our mugs, are going to be available online soon on mongeneral.com.
My mug.
There will be rioting in the streets, won't
Stay
it, Jim?
tuned for news next.